So my name is Kelly Rockwell, and I am the manager or the clinic manager here at the Wildlife Medical Clinic, and I'm also a third-year veterinary student. The clinic here was founded in 1978. It's always been student-run, but over the years it's certainly grown more in what we're capable of doing and housing. So we are completely student-run, so we work with veterinary students as well as undergrads. At the moment we have about 120 students, which we typically have every year. And we provide a free service to the public, so if they find any injured or ill wildlife animals, they can bring it here to our clinic free of charge, and we'll take it and try to do rehab as best we can to ideally release the animal back into the wild. We see, about 120 to 150, 1,200 to 1,500 animals a year, ranging from birds and mammals to some reptiles every now and then.
This is a bald eagle, and she's been our intern. Dr. Rosenhagen has actually been working with her and training her to get her used to accepting food from people, so she's not as stressed out being in here. And then to actually get her used to stepping up on a glove, because she had a lot of negative associations with a glove, because we'd have to capture her, every other day to do surgery, do meds, look at her wound, this and that. So we've been working a lot to make her comfortable being here. Unfortunately, she also is unreleasable because of that wing, but we're looking for, any zoo or wildlife clinic that can keep her as a resident.
And then we have another vet, Dr. Nikki Rosenhagen, who just recently graduated from here, and she's a 2-year intern here. And so most of our invasive surgeries, like fracture stabilizations or anything where you're opening up the body, is usually done with them or under their guidance. Some of the other surgeries that we do more commonly, like the ones with the turtles, with their shell repair, myself or the other manager can do, and we can kind of show the students how to do.
My name is Gloria, and I am just a volunteer for this year.
Hi, my name is Megan, and I also am a volunteer. I'm also one of the resident mentors that we have here on staff. We do on the teams, and I came in over the summer as well. It was just the summer before Gloria started it, so I came in 2 summers ago. But so you're able to give medications. You're able to, help feed if an animal needs tube feeding. You're allowed to change bandaging, clean, do a lot of hands-on work and a lot of experience that I know I haven't gotten at other practices due to liability reasons. You can't touch usually the patients, but it's not, when it comes to like the really serious surgery and whatnot, usually we don't get to do. We can watch definitely and maybe help out if they ask for something, but it's usually not something that we get to do because we don't. That I think, and Gloria and I both, just speaking for ourselves as opposed to like other people, we both really enjoy it here. We both really like the experience we get, and so even though, and this I can't speak for you, but like with me, even though it does get stressful sometimes even a lot of the time, like this semester especially has been a very stressful, kind of unlucky semester for a lot of teams and a lot of patients, but it's still so rewarding. The people we get to work with, the patients we get to work with, and the things we get to learn and do. But like you said, especially when you put all that work into a patient and being able to release it, it's definitely probably the most rewarding thing that we can think of. It's like makes all the hard work worth it.
Yeah, definitely.